Mamas, the importance of understanding how to properly hip hinge. All right, this is for you because you're always bending over, right? So think of it, and a lot of moms tend to end up with this kind of posture: forward hips, rounded forward shoulders, okay, and forward hip posture, because they're always bending over, right, to take care of baby, change diapers, pick baby up. And, with enough repetition and things like that, our body starts to reflect those positions we're constantly putting it in. So, and if you're experiencing, which most moms end up experiencing, some sort of back pain, among other things. So, how can we alleviate this, or how can we even prevent some of this? Hip hinging. Very simple concept. And think of it even when you're doing dishes, when you're brushing your teeth, anytime you're kind of bent over a sink or something like that, all right? Hinging forward versus rounding, okay? So, first and foremost, grab a broomstick, handle, whatever. Grab mine here. And we want to find that neutral spine. So, we want to make sure that head is centered on the spine. The area between the shoulder blades is making contact. And then our tailbone. So we have a little space under that lumbar. Okay, start with those feet hip width apart. Knees are a little soft here. And just hinge forward, push your butt back and up. Okay, and this is going to help us practice that nice neutral position with our hip hinge. We're lengthening out those glutes, which is really nice because moms tend to have, contracted glutes all the time with those forward hips. So we want to give those glutes an opportunity to lengthen. Okay, in that neutral spine, we're learning to engage our abdominals in this neutral position. Our shoulders aren't slumping forward. Okay, our head is centered instead of forward as well. So practicing that and thinking about it, okay, hinging forward, brushing your teeth, changing a diaper versus this. Okay, this is really hard on the spine, that constant repetition. Okay, if you're going to pick something up or baby up, okay, we start with a hip hinge, again, neutral spine, then you go into that squat position, making sure, again, you're not rounding forward, but you maintain that shoulders back, bend those knees so you can get closer to the floor, and pick baby up from there, okay? That, I'm promising you, is gonna make such a difference in your spine, in your back, and a lot of those ailments that a lot of women experience when they're taking care of those newborns. So, hip hinge. Give it a go, practice, 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 and let me know how it goes.